Welcome to Trifecta Collective, Finding the Root, where we dive deep into understanding and addressing root causes of chronic health issues so you can help and find healing inside and out, now and forever.
Hello, and welcome to Trifecta Collective, Finding the Root. I'm Megan Abbott, owner and founder of the holistic health practice Trifecta Collective. Welcome to the podcast. So today, I am going to be talking about all things histamine related. This is a growing topic, or at least it appears to us this way via social media. And we put out some content the last few weeks around histamine related kind of issues and different things. And man, we get so many questions around so many of these topics. So I thought I would do a very specific histamine related episode. I know I've done ones around like mold and histamine, mast cell and histamine issues, but I'm going to talk just histamine issues today. And I'm going to go over some histamine related issues in regards to, allergies versus histamine issues, because there can be a lot of confusion around those topics and which is which, and around low histamine foods, high histamine foods, histamine liberating foods, all of the nutritional side of things I'm going to touch on and share a lot of thoughts. And then get into how we need to zoom out when we look at these histamine issues. And this is where most practitioners in the functional health space, this is what they are not doing. They are looking at histamine issues, maybe they're tying in mast cell issues with it, and then only addressing those, which is such a big mistake, by the way, and totally fine if that's what you want to do. If you just want to symptom manage these things, like I am absolutely going to talk about that, what that might look like, what might support and help. I'm going to talk about that at the very end when I talk about supplements and other related things. But if you actually want to fix your histamine issues, we really need to zoom out here and take a deeper look at the role of histamines. And I'm going to take a big picture. I'm not going to do deep dives into any one of these things, but I'm going to touch on all of them in this episode. And we've done pretty deep dives into a lot of these topics, which is the biggest reason why I'm not going to do that today. But just to get you really thinking as to, okay, you've got these histamine issues. Let's talk about when and how they're happening, because that's going to give us a lot of insight. And then zooming out and looking at the bigger picture, if you actually want to fix these issues and not have to worry about the food side of things, not have to consistently be on supplements, not have to always be worried, have an allergy pill on hand, have a Pepcid on hand, have a Benadryl on hand, what these really look like. And there's going to be varying degrees of issues here. And I've seen people with just minor, maybe they get just a little itchy occasionally when they have something that triggers a histamine response, including food, to, full on lips are swollen and red, eyes are swollen and red, rashes, hives. And by the way, these are not allergic reactions, which this is a good segue into the first thing I wanted to talk about, which is histamine issues versus allergies. So I'm going to give you a technical definition of an allergy here, and then I'm also going to share some other thoughts as to, because we see allergy shift and change all of the time. I've personally experienced allergy shift and change over time, and there's some pretty clear reasons as to why this happens. That, if you go to an allergist, a lot of our clients, especially our mold related clients that come to us, have been to an allergist, have been to an immunologist, have done allergy tests, like significant allergy testing on the body via blood work. And then also a lot of them have also done allergy shots, and some have seen relief. Many have seen no major changes, which is very unfortunate because they can be really expensive and really intensive. And once again, like, not saying they're bad. And they don't always fix everything like they're supposed, quote unquote, supposed to. So if we look at a true food allergy, and let's talk, we can talk food allergy, but this also does apply to certain other things, especially like a lot of trees, a lot of different mold. A mold allergy versus a mold illness are two very different things. And I will touch on that again when I get to bigger root causes. I've also talked a lot about that when it came to different mold and mast cell podcast episodes and other content that we've done around that. So definitely go check a lot of those out here. So we think about a true allergy. It's an immune-mediated reaction, most commonly involving an IgE antibody response. In addition to that, and I'm going to go technical here, and then I'm going to talk a little bit more plainer language to unpack this for you. It's typically reproducible every single time. Every single time a food is eaten, an allergy exposure is near you, there's going to be a pretty quick reaction. Okay. So if we think about a food allergy, let's say a peanut allergy, that I feel like is one of the most common ones that we hear about. So someone has a peanut allergy and has been diagnosed with a peanut allergy. Are they going to have a peanut allergy forever? Well, question mark. Maybe, maybe not, if it is a true allergy. And if someone is exposed to a true allergy, once again, like this peanut example, they're in the vicinity. I mean, some people are so sensitive where they are in the vicinity of a peanut and they can start, some throat starting to swell up, starting to get itchy, these kinds of things. Let alone they touch a peanut, they ingest a peanut. I mean, we're looking pretty quick reaction here. Versus, let's say we have a food sensitivity to, let's say, strawberries. So let's say you have a food sensitivity to strawberries. So you eat a strawberry, and maybe while you're eating the strawberry, the roof of your mouth starts to get a little itchy. And you start to scrape your tongue against the roof of your mouth. And you're like, man, that feels really good. Maybe you get like a little red on your cheeks or on your neck and your chest. Throat is not swelling up. It might feel like it starts to get a little tighter, but you're not going into anaphylactic shock. You don't need an EpiPen. Maybe you get just a little itchy for a bit. And every time, it's like almost every time you eat a strawberry, this is happening. But maybe it's not every time. And maybe sometimes it's immediate. Maybe sometimes it takes a little bit longer. Why? Why would that be different? Is it actually an allergy? Do you need to avoid strawberries all the time? Well, maybe. It's debatable. So this is an immune response. And when we look at this immune response, we need to look at the immune system. And if the immune system is specifically targeting, reacting, attacking a certain thing, well, if there's something else interacting with the immune system and we address that, immune system comes down, are we going to have the same reaction? It really depends on the person. It depends on the circumstance. But I have seen people go from pretty significant food, allergen, outside allergies, pet allergies, to no allergies, to seasonal allergies, to no allergies, from no allergies to seasonal allergies. What is the biggest difference here? Well, we need to look at the immune system. We need to have a better understanding of what is going on with the immune system. Is the immune system hyper-responsive? Is it activated by something? Is it triggered? What is going on with the immune system? And if there is something going on with the immune system, if we address that thing that's impacting the immune system, sometimes the allergy dissipates and it's not as bad. Sometimes it completely goes away. I'm going to get into this more later, but I'm going to throw it out there for you to keep in the back of your mind as you're listening. one of the things that will often happen in an allergic, quote unquote, allergic response is mast cells are activated. Mast cells are immune cells, so they're part of your immune system. So along the same category of what we're talking about here. So they're a type of immune cell. These immune cells are pretty much everywhere throughout our body. There are more in certain places than others. Your gut is a big one. Your face, your brain are two other really big ones. When mast cells are activated at high levels and or consistently activated, they also release histamine. And so sometimes in some people, mast cell responses will appear as allergic reactions. One other piece I want to address when it comes to this. So food sensitivities versus an allergy versus an immune reaction. So there's a lot of other pieces that go into food sensitivities. A big piece of a food sensitivity is you eat the food, goes into your you start digesting it, goes into your stomach, goes down, gets into your small intestine. Now, in your small intestine, one of the big things that happens is nutrients are absorbed, allowed out of the small intestine, go into the bloodstream, go up into the liver to be filtered, circulated, all the things. However, when we talk about things like quote unquote leaky gut, which is more of like the colloquial name versus the, I would say, more standard term that we use from a clinical perspective would be intestinal permeability. This means that there are junctions. There's basically like gates. Talk about little gates throughout your small intestine. And if you're watching this, this is the visual I always like to share. So we have these gates, and these gates are really strong. They are very interlocked. It's very hard to get through these gates, except if things are really small, like nutrients. However, for a variety of reasons, once again, I'm going to talk about this a little bit more when I get to root causes of histamine issues. These junctions, these gates in your small intestine can start to break apart, and these gates start to become loose and open. And this allows other things to leave our small intestine that should not be there. Food particles, undigested or not properly digested food particles, are a big one. This is why a lot of times you'll see people start to develop sensitivities to foods over time. Because when these foods, especially if you are eating very, very similar foods every single day, those food particles are going to leave your small intestine, go out in your bloodstream where they are not supposed to be. Your body recognizes they are not supposed to be there. So they send immune cells to start attacking these food particles. Now, if your immune system starts to attack food particles, and if it's the same food particles every single day and time, so sorry if you're watching it, saw Cusco go a little crazy behind me. He's in his crazy mood. So if your immune system is consistently attacking these same foods, well, your body's going to start to remember that. So when you eat the food, your body's going to think it's going to have an immune reaction, immune response, we'll say, and you can start to develop the sensitivity sooner and faster. So that is also a real thing. That absolutely can happen. So if people are eating, let's say if they're put on a restrictive diet and they're eating about 10 foods all the time and they only eat those 10 foods. Well, food number one, if you're eating that at least once a day, sometimes multiple times a day, and you've got this leaky gut issue, well, guess what's probably going to happen here? Can be a few weeks, can be a few months. Your body might start reacting to that food. And then now it's going to start to react to food number two because you cut food number one out. Now it's going to start to react to food number two. Now you cut food number two out. This is how people get down to 3 to 5 foods a day. This is a piece of it. This is not everything, but this is a piece of it. This was a big piece for me. This is one of a whole lot of reasons why we will often not recommend Food sensitivity test, number one, because your food sensitivities will change over time. But also strict elimination diets for a significant period of time. We do not recommend those. We will use these kinds of therapeutic diets in the way that they were meant to be used, short term for very specific people for a very short amount of time to help reduce symptoms while we work on the bigger issues. That is what these elimination diets, these therapeutic diets, these restrictive diets were really meant to be. They were not supposed to be, all right, this is just the way you eat now forever. Because I will tell you from personal experience and also having so many clients come to us from other practitioners on very restrictive diets, it's no way to live. It's not good for you. It causes a whole variety of other issues, particularly nervous system related, mentally and emotionally related, that can also trigger histamine, mast cell, and food sensitivity issues. And if we were doing that in the first place to do the opposite, sometimes that doesn't happen. Sometimes it can get worse. Once again, they have a time and a place. They have a purpose for use, of course. And if you're on an elimination diet for more than a few months, no. If that is the way you're trying to heal your body, probably not going to fix a lot of things. If you have a lot of chronic health issues, if you just have a little bit of bloating here and there, or you have some loose stool every time you eat ice cream, maybe don't eat ice cream all the time. Pick and choose your battles. Maybe your body doesn't do the best with a bunch of dairy and sugar and potentially gluten in that thing of ice cream. Maybe you switch to a non-dairy alternative or to something with a little bit better ingredients or homemade. There's a lot of other things here. And yes, these other things can be more work. Some of these things can be more expensive. Pick and choose your battles. There's no right way to do this. It is a matter of what is in your capacity to do physically, financially, from a lifestyle perspective, but also, are you looking at the bigger picture? Do you want to look at the bigger picture? And if you don't, that is okay too. And recognize that these things add up and layer on top of each other. So a lot of times things that start off not so bad, we look a year, 2 years, 5 years, 10 years later, things are pretty bad. And it's a lot easier if you start earlier. And most of us don't, by the way. I did not either. So I'm not putting any blame or shame on anyone. And I will tell you just from personal and clinical experience that, yeah, the earlier you address some of these things, the easier it is to usually get on top of them and to address and then potentially reverse many of these things. So understand that there is a difference and there is some overlap between, histamine reactions, mast cell reactions, and allergies. There's also something really interesting if you want to take a deeper look. And I've never personally used this technique. I have worked with a lot of people who have. I know practitioners who use this. I am a huge fan. I've seen incredible results from clients using this. It's called NAET. And it's a way to retrain the body almost. I consider it almost like a form of brain retraining to make your body not so hyper responsive to a lot of allergies. And this has worked I've seen it work with seasonal allergies. I've seen it work with like pet allergies, with certain foods. And once again, do I think this technique alone is going to fix everything? Maybe. It depends on the person, depends on what you have going on. But doing a layered approach where, let's say you do have a bunch of gut issues going on, gut overgrowth issues, you are working on the gut piece and also using this, double whammy, double bonus, even better results at times, assuming it's not too much for your body, because that is always a very important piece to all of this to make sure it's not too big for you. Okay, let's talk about high histamine, low histamine, other histamine related when it comes to food pieces. So when it comes to the food piece, I'm not going to go through and bore you with just naming a bunch of foods here. I'm going to share some resources below in the show notes or in the caption, depending on what platform you're using, that talks more about this. I am going to talk a few here. But before I even get into that, understand there's a lot of controversy in this space of what is technically high histamine, what is technically low histamine, what is technically histamine liberating. Because then we also need to look at oxalates for many people. We need to look at your mast cell response. We need to look at gut issues, gut overgrowth type issues. So there's a lot of layers to this, and you will see differences in all of these lists, depending on who you talk to, who you look at. This is also not to say, once again, just to reemphasize, we are not fans of a low histamine diet. We will use it sometimes for people who are reacting to most high histamine foods, or we will do a version of this. Or we may do a lower oxalate diet, or we may do a lower sulfate diet. Those are all different. There's some overlap. It really depends on the person. I will also tell you once again, a low histamine diet out of all of the restrictive diets I did personally, this was the worst. I'm a big fan of meal prep, food prep, leftovers. As food sits, fresh or cooked, it grows histamine. So this is a big issue. And I would do my whole thing. I would make all the food. I would portion it out. I would freeze it. I would unthaw it. I mean, listen, I did all the things. And it did not work. It did not work for me one bit because no one was looking for me. Parasites and heavy metals were the biggest things that were impacting my histamine issues. And it took quite some time to find those, let alone figure out the best way to address them within my own personal body. So really keep in mind that this is going to be dependent on the person. I'll also say this can depend on the state of your body in the moment. If you are going into eating and you are very stressed, you are running around doing a whole bunch of things, and then you go to try and shove some food in your face, probably a higher chance of a reaction versus if you are eating breakfast and you got to have a good night of sleep and you woke up, you did some breath work or some mindfulness work, and then you're going in and you're eating a nice good breakfast and you're eating slow and chewing your food and not having a bunch of liquids with your meals. Like the state of your mindset, body, stress levels, like this is going to impact things. Some of these things, avocado is probably one of the best examples. The amount can also matter. Technically, from most things that I've seen, a quarter of an avocado is considered low histamine. You get up to half an avocado, it is now considered moderate to high histamine. So sometimes the quantity matters. So all of this is to say, there is no one way to do this. One of the best things I can recommend if you are having a lot of histamine type issues, and I did a video, I think, about this not too long ago. One of the best things, instead of just jumping in to a crazy diet, track your food and how you feel for a few days. And I'm talking write it out, type it somewhere, use AI this can be a tool for this. And I'm not super pro or against AI. I think it can have a time and a place. I don't know if it's actually going away ever at this point in time. So, it is what it is. Some people very much rely on AI. I caution you on using AI as a practitioner, as a therapist, as a professional tax person, as a lawyer, as any of these things, because there's a lot of nuances. Even the best of the AIs can lie. And I mean, I know when I've asked questions that are a little borderline. I'll say I'm working on a project and I was curious on just a couple things, and I am going to talk to a lawyer, and I wanted some feedback. I was curious of what this process might look like according to AI, and it actually did a really good job in saying, hey, I am not a legal professional. You should always consult a lawyer, which I very much appreciated. And I knew going into that I was not looking for a formal legal response, just some guidance and baseline direction on what I was looking for. So, when we look at these things, AI can be a tool. If you're very anti-AI, also, you don't need AI for any of this. If you try, we call it a food and mood journal. We do this for every one of our clients when they first start with us. And you don't have to write all your calories and quantities of everything, but what did you eat? For breakfast, you had yogurt with some berries and honey. Afterwards, you felt bloated. You had maybe a looser bowel movement and were a little itchy. Okay. If you had the same breakfast the next day, but you didn't have a reaction, all right, let's look at other factors. Maybe it's not even the food. Maybe it's something else going on. Or if you had the same breakfast 3 days in a row and you felt the exact same way. And sometimes, by the way, you do not know this until you write it down and actually take a look back at it. You realize there can be some really specific patterns. And I'll tell you, we have clients give us some pushback on some of this sometimes because they're like, oh, well, I've done it before and I've never noticed anything. Okay. I'm coming at this from a different lens. I've been in this space for over a decade. I've worked with well over 1,000 clients at this point. I have a lot of knowledge around food, around how body works, around all of these things, and I will probably notice a pattern. I don't know if I've ever not noticed a specific pattern when it comes to a lot of this. There's usually some pretty clear patterns. And sometimes they're more clear to me, or another trained practitioner versus someone who maybe, maybe your specialty is in something else. Maybe you work in the public health space, or like we all have our specialties. I'm not a lawyer. I'm not an accountant. Those are not my areas of specialty. I know a little bit about some of those just based on my own experience, but by no means am I formally trained in any of that, and I should always consult a professional. And by the way, traditionally trained doctors, know nothing about any of this because they are not trained. There is no magic pill outside of an antihistamine, a Zyrtec, an Allegra, a Claritin, that will fix this. If you go to an immunologist, maybe you get an LDN. Some people are now using microdosing GLP-1, specifically tirzepatide. I think that can be valuable in very specific cases, not all cases. It is also not for weight loss. It is for stability within the immune system. Same thing, autoimmunity. There's some. I don't actually know if there's studies coming out quite yet, but I know there's a handful of people in this space who are using this and talking about it, microdosing GLP-1s for we'll call it immune stabilization, autoimmunity issues, MCAS, different kinds of issues like that. So, LDN, you might get prescribed. There's a handful of things that people can get here. Anyways, let's go back. Let's go back to these high histamine foods and histamine liberating foods. So, quick rundown of some of the biggest offenders. Anything fermented is going to be big and typically very high in histamine. So some of those things can include like sauerkraut, kimchi, kombucha, yogurt, kefir, miso, tempeh, but also things like soy sauce, all your vinegars, all that kind of stuff. Aged meats and cheeses, things that are fresher typically are okay versus things that are aged. Canned and or smoked fish. Once again, it's been there for a while. If it was smoked, it was cooked for a while. Anything that is cooked for longer periods of time or left out for longer periods of time are typically going to be bigger offenders and higher in histamine. Alcohol, blanket statement. Leftovers. Many spices. This is something that throws a lot of people off. There's a lot of spices, especially a lot of your warming spices. Cinnamon, nutmeg, like some of these more warmer spices, but there's quite the variety, by the way, can be considered high histamine for many people. Many teas, coffee sometimes can be, and by the way, there's some other things that can go along with those things. Sometimes it's a caffeine issue. Sometimes it's the quality of the ingredient or things can go a long way here. Bone broth is a big one. Once again, anything cooked for a longer period of time is going to be higher in histamine. Histamine liberating type foods here. Now, I also want to note that there's often a mast cell component, specifically when it comes to histamine liberating foods. So if you have underlying mast cell issues, which once again, I'm going to touch on those. Also have a handful of podcasts that went over this. I've got a 2-hour, I'll put this down below. A 2-hour masterclass that's $11 for 2 hours. And I go super in depth into this. Mold, mast cells, and histamines masterclass. So we'll put a link below for that, but very inexpensive and packed full of all kinds of information here. Okay, so fruits. If you have fruit that is very ripe or vegetables that are very ripe, typically more on the higher histamine liberating category. So if you have a banana that's pretty unripe, like fairly green, you might be okay with it. But if you have a banana that's pretty darn ripe, has some of the brown spots, has been out for a while, you might react to that. We also need to note that there can be some crossover issues here. Sugar content goes up the riper fruits are, and the less usually positive things that we can get out of fruits, less antioxidants, less nutrients, just less of the really good things, specifically fibers, is a really big one that will go down the more ripe fruit is. If you have SIBO issues, if you have candida issues, like you may already do poorly with some of these things too. So I also, once again, keep that in mind that there can be some overlap here. So citrus is often histamine liberating. Strawberries, I mentioned, pineapple, papaya, kiwi, bananas, super dependent on the person. Tomatoes, eggplant, spinach, avocados. Once again, certain amount of avocados. I also see this with strawberries quite often. I forget what the number is off the top of my head, but sometimes a certain number of strawberries will be okay. But if you have more than that number, it may not be okay. Anyways, I have, not fans of these things for the most part. All right, walnuts, peanuts, cashews, chocolate is a big one, shellfish, other types of fish that, once again, like canned fish, smoked fish, you're going to want to choose, if you have a lot of histamine issues, flash frozen fish may be a better option for you. How quickly that fish is flash frozen may also make a big difference, where some brands may be pretty quick, other brands may not be, and so you may react to some of those brands. Let's see. And then I'll say, just like blanket statement, food additives and preservatives. Once again, there can be a strong histamine component here, but there's also a big gut component here where your body may not tolerate some of these chemicals, additives, preservatives put in food. And it may not be histamine related. You may present as a histamine symptom, but it may not actually be histamine related. It might be more mast cell related, which, there's a direct connection between those two things too. Maybe more just gut. It may feed some of certain bacteria, we'll say non-commensal or not the best bacteria in our body. Some of that can produce histamine. Parasite overgrowth can absolutely produce more histamine. So once again, this might sound super woo, but you may react more around a full moon. And is that because it's histamine related? Well, yeah, yes and no. Might be parasite related. Around the full moon, melatonin, because it's brighter outside and our bodies know that, our melatonin can drop. When our melatonin drops, our serotonin can naturally start to rise just a little bit to compensate. Parasites, good, bad, other, the amount matters here quite a bit. Parasites have serotonin receptors, so they can be more active around the full moon. Some people might get a little moodier. Some people might have more food reactions, trouble sleeping. That could be melatonin related issues and or serotonin related. So there's a lot of factors that go on here. And this is not as simple as eat this, don't eat this. It's just because of this. It's not. And if someone tries to black and white this stuff for you, be like, nope, it's just a gut issue. All we have to do is fix your gut. We're just going to do a stool test. We're going to kill all the bad stuff. We're going to put all the good stuff back in and you'll be totally fine. Please, please run so fast. Because if they're not also looking at all the things that impact the gut, toxin load, drainage pathways, your nervous system, movement can play a big role in all of this, how you're eating, all of this plays such a big role. And yeah, we do a lot of gut work in our practice, but we do it also in conjunction with a variety of other things, looking at the gut, but also looking at all the things that impact the gut, because we know that we're not trying to do these protocols over and over and over again. It's like SIBO, small intestinal bacterial overgrowth. If you have SIBO, you take a SIBO test, maybe it shows up on a stool test, maybe it'll show up on an organic acids test. Maybe you just suspect it. Maybe your GI doctor told you have SIBO. Just take these antibiotics. Whew, we are missing the bigger picture here. Bigger question: how and why did this bacteria that is supposed to be in your large intestine overgrow, come up in your small intestine, make you sick? If we just kill it, it's probably going to come right back. And starving, it's not the answer, because they're going to go hide and they're going to put up these lovely protective barriers we call biofilms, so that when you're done with this killing work, when you start eating, quote unquote, regularly again, so many people have the same issues come right back. It's not a surprise. I have also been there. I did so many SIBO protocols and none of them worked until I figured out actually why I was having the SIBO and addressed all of the things that impacted the SIBO. And we see that a lot within our practice here. Okay, so some tips and tricks on eating a lower histamine style diet. Buy and cook your food as fresh as you can get it. There are some limitations here, of course, but just do your very best. If you can go to a farmer's market and it's local farmers, did you just pick this stuff yesterday? Perfect. It is so fresh. So the likelihood that you're going to react to anything is going to go down just because of how fresh it is. When you buy meat, especially, buy it as fresh as you can get it. If you're not going to make it like that day or the following day, put it in the freezer. Once again, as food sits fresh or cooked, it will grow histamine. So if you can freeze it right away, that will go a long way. And then if you cook from frozen, can also really help reduce the histamine load within that as well. Freeze your leftovers. Flash frozen is going to be your best friend. That can include fruit, vegetables, meat, fish, not just fish. So anything flash frozen will often go a super, super long way. Faster cooking methods are also better. So I know for me personally, I'm a huge fan of a crock pot. It's so easy, so simple, such a big fan. If I wanted to eat low histamine again, not my best friend. An Instapot is a great alternative where you can cook things similarly, but in way less time. So, for example, we'll have some people want bone broth and feel really good with bone broth, but the store-bought stuff, it definitely will cause some histamine reactions. So they decide to make it in a more of like a meat stock than a like bone broth, make it in the Instapot and or on the stove, cook it for way less time. Makes a big difference, like 2 to 4 hours versus 10 to 12 hours. Big difference in the reaction. So meat stock could be an alternative to bone broth if you are a big bone broth kind of person here. Okay, so those are my tips, some tips and tricks for eating lower histamine without changing a ton here. Let's zoom out now and look at the bigger picture. So first and foremost, if we have a lot of histamine type issues, there could be too much histamine being produced. This is not necessarily root cause, but it's something to think about. Why? Why is your body producing so much histamine? And keep in mind There can be multiple answers to all of these things. We've had plenty of clients come to us, and I'll tell you, like, I think every single one of these things is absolutely playing a role. And when we address all of these things, then they start to get better. But sometimes we don't see a ton of improvement when it comes to their histamine-related symptoms until we address all of these things. So too much histamine being produced and or kind of to couple with that, too little DAO being produced. And DAO is something our body naturally produces, and it helps to break down histamine. Yeah, okay. I was going to share a story, but I decided against sharing this story here. Okay, so too much histamine and or too little DAO. This could be nutrient deficiency related. Could just be that. Maybe you've got a bunch of nutrient deficiencies. Once again, this is where blood work really can be very, very helpful as a starting point, because we're not going to see all nutrient deficiencies, in basic blood work. We can absolutely run more extensive blood work and get almost all of them run. But also, we get a pretty good picture. If we see just in some basic blood work, I'm talking like a metabolic panel, lipid panel, a CBC with differential. If that's all we have, there's a good amount of nutrient deficiencies we can see just in that. Now, if we add on a few extra things with that, even not specifically nutrient related, some blood sugar markers, some iron markers, some different things like that, yeah, then we can start to even expand even more. And then, of course, once again, we can also run specific nutrients as well. But in order to produce enough of anything, if our body's naturally producing things, let's say DAO, one of the big things that our body needs is really good mitochondrial health. Mitochondria are the energy powerhouses of our cells. And if our cells don't have enough energy this is like big rabbit hole. For so many reasons this could be happening. This could be just you're not eating good food that has real nutrients. That could just be a big one. Your body's not hydrated. This will impact your mitochondria for sure. So all of these things can play a big role. So nutrient deficiencies, we'll say blanket statement for a variety of reasons, whether we're not eating those, whether we're not properly digesting them, whatever something is stealing our nutrients, all of those things can play a really big role here. So getting into that, gut overgrowths. Gut overgrowths, man, they're a really big one. Bacterial issues and parasite overgrowths in particular really, really can be directly related to histamine-related issues. Parasite overgrowth alone absolutely can cause histamine-related issues. This is a really, really, really big one. And I'll tell you, many people are not doing parasite work in a very good way. When we have parasites, we all have parasites. We also all have bacteria. We all have yeast, fungus in our body. And we should. It's supposed to be there. That is how our body's supposed to work. Unless we have too much of these things or they travel to places where they're not supposed to be. SIBO is a great example. We have all this bacteria in our large intestine, but it should not be in our small intestine. And if, for example, if we have low stomach acid production, oftentimes that'll result in that bacteria overgrowing up into our small intestine, causing an issue like SIBO. Bacteria, it's good for our body. It's supposed to be there, just not in our small intestine and in not those quantities where it's making us sick. We're having bloating issues and gas issues and bowel movement type issues and food sensitivities and all of these other things. So gut overgrowth, big one. Specifically with parasites, you need to look at their food sources. Parasites feed on toxins especially. If you have any sort of toxin overload issue for whatever reason, whether your drainage pathways aren't in a good spot, whether you've got nutrient deficiencies impacting your drainage pathways, I'm going to talk about this here a little bit more in just a moment, or exposures high, whether that's heavy metals, environmental toxins, or mycotoxins or mold, that feeds all of these gut overgrowth types issues. And they can travel. I mean, parasites in our lungs, parasites in our sinuses, not to be super gross. Parasites in our reproductive system as women. Huge, huge, huge contributing factor to formerly known as PCOS, PMOS, and endometriosis. We have been very fortunate to have worked with a handful of women who were borderline on getting a full hysterectomy because their endometriosis specifically was so bad. And we were able to prevent them from having to get that surgery because we were able to help their body feel good enough and reduce this endometriosis enough, almost, and every single patient that we've worked with in this or client that we've worked with in this field, specifically with PCOS and endometriosis, we almost always do parasite work. And I'll tell you, the women that we were able to help save their uteruses, parasites were playing a big role. And that was a really big factor in being able to save that. So just to let you know that there are options here, there are also no bad decisions. If you feel like a hysterectomy, full or partial, is right for you, go for it. Let's make sure, though, that we are supporting your body before and after. Because most doctors will tell you you'll be fine. You don't need it. We were just born with that. We don't need it. You don't need a gallbladder. You don't need your spleen. We need all our organs. They're not accidents as to why we have them. Okay, so gut overgrowth. We'll also say leaky gut type issues, which I'll say leaky gut commonly almost always comes with gut overgrowth issues, can also come with other types of issues, toxin overload issues, eating poor quality food and a lot of preservatives, additives, chemicals, all that kind of stuff can also play a role in quote unquote leaky gut or intestinal permeability, but that's also a big one. Hormones. This is another big reason why I always recommend write some things down, because estrogen and histamine attach to the same receptors, cell receptors in our body. So if we have real or perceived, we'll say too much estrogen and or estrogen dominance, that can exacerbate our histamine issues. And what I mean by real or perceived, and I know I've mentioned this several times, but I think it's really important to keep emphasizing this. So real estrogen dominance. Typically, we're looking at one of two things. One, our body's producing too much estrogen. We need to ask why. Why is our body producing too much estrogen? And or why is our body not metabolizing estrogen properly or appropriately? Tell you the second option, it's usually the bigger factor. Perceived estrogen dominance would be our estrogen to progesterone ratio is supposed to be very specific. There's a range, but it's supposed to be within a good range. That range also is going to depend on the person and a lot of other factors here, which is why I'm not going to give you a range. When progesterone drops for a variety of reasons, our body can perceive that as too much estrogen because it's too much in relationship to your progesterone levels. So if the week before your period, you start to notice, man, I am so stuffy, I am itchy, I have more food sensitivities, I react more from being outside. Probably not directly an immune system issue. There's a likely at least a hormonal component to this. This is also why in perimenopause, man, I've seen some people who are just getting into the perimenopausal space because of their own age, practitioners, and being like, oh my gosh, histamine issues, they're such a big thing. Here's what to do. If you really know the body, of course you know histamine issues are going to play a role in so many women when it comes to perimenopause. Because the very first thing that happens, and this is going to happen in your early 30s. I've seen women in their 20s this has happened to. This happened to me before I was 30. My progesterone dropped so low that technically, and my hormones overall dropped so low that I was technically perimenopausal, like clinically perimenopausal. So, but I was able to get myself out of it. I've now been able to get myself out of that twice. And not saying, and I'm going to go through perimenopause too. And so what are things that can impact us going into earlier perimenopause that will cause our progesterone to drop sooner, to drop it faster? Stress. Stress is the answer. And I'm talking big picture stress, inside stress, outside stress. So the first thing that'll happen in perimenopause, and this is very subtle, this is why if you are in your 20s or 30s, I highly recommend tracking your periods. Use an app, use your phone, I don't care. Use something. This is so helpful because when you start to see these shifts and changes, you're going to start to be able to notice them a lot faster and understand where your body was versus where your body is now. This is why getting regular blood work is also super valuable for a variety of reasons. So we can start to see changes and notice these changes over time, and we see patterns that give us a lot of insight, helpful information as to what might be most supportive for someone in their body. So progesterone's going to drop first. Then estrogen goes on this really intense, for a lot of people, roller coaster. It goes up and then it drops and then it comes up and then it drops and then maybe it's up a little bit and then just maybe it does little waves and then it does a big spike and then a big drop. The feeling crazy, the not feeling like yourself, the sudden switch in moods and or emotions that many perimenopausal women, and by the way, non-perimenopausal women, especially the second half of your cycle, that you may experience, it's this rapid fluctuation. This is one of the reasons why blood work can be a little iffy when it comes to hormones. And there is absolutely validity in looking at hormones from blood work, but also urine and saliva, which is going to give us way more time frame based data versus just a moment in time. They all have a time and a place, and we need to understand the limitations of all of them for reference. So many practitioners who do prescribe HRT either don't run labs or will only run blood work, and they won't even look at a Dutch test. And it's such a shame that once again, just women's health is not anywhere close to where it should be in comparison to men's health, especially. So when that progesterone drops by itself, we can start to have these extra histamine related issues. And then when you get those estrogen spikes, man, you can really feel them. The itchy ears, you're feeling like you're itchy all over, feeling like you're itchy on the inside, but there's no skin stuff going on. You feel like you have bugs crawling inside of you. Some women will start to get flushed in their face, in their neck, and their chest. Some women will get rashes or hives. So those are all really, really common histamine related issues. You are not doomed to have these things. If we support your body appropriately, you will have minimal histamine related issues. One of the biggest things from an HRT perspective that women will typically put on first is progesterone. Progesterone by itself and or progesterone, little bit of estrogen with the progesterone. Many of these symptoms can go away with progesterone. And here's the thing. I'll tell you, so I was very close to starting HRT a few months ago. More than a few months ago, many months ago, probably like 6-7 months ago, because I could tell my progesterone just from the stress of last year and everything that happened last year with my fiance Jonathan and his health and cancer and work stuff. And I mean, just the stress was too much, and it hit my body at a certain period of time. And there were other factors that also went into that for reference, and I've shared a handful of those previously. So we can look at just progesterone for some women, whether that's HRT related or, there are other routes to go on that can also be supportive. Chastry or Vitex is a supplement that can be supportive of helping naturally raise progesterone levels. I keep it on hand still. That's what I ended up using to support my body. I use it with clients here and there as it is deemed appropriate. Very, very minimal side effects for most people. I'll also tell you, I've seen almost no side effects for any clients I've used it with. I had multiple side effects for a few days when I started taking it, but with clients I've actually never seen any side effects, which is pretty cool. Or minimal, very, very, very minimal kind of side effects. So that can be an option. Sometimes it's just progesterone for the week before your period. For the chastria, I keep it on hand. I'll take it anywhere between like 2 to 7 days, depending on how I'm feeling. If I notice my sleep starts to get worse and it feels very cortisol related, very stress related, my brain's not turning off. I have a 3 a.m. wake up. I'm having a hard time going back to sleep, having a hard time just settling and getting relaxed. It's probably cortisol related. So some women will actually do more cortisol related support to drop cortisol. And that'll help naturally raise progesterone because they move in opposite directions. So cortisol goes up, which is a stress hormone. Progesterone's going to go down. So those are some things that we can also look at. But once again, there's a lot of factors that go into that. Sometimes it's the estrogen metabolism that's playing a bigger role in all of this for a lot of people. Drainage pathways, especially your liver. If your liver's overburdened, it can almost like stockpile histamine and can exacerbate histamine. And sometimes all we need is some extra drainage pathway support work. I've never seen milk thistle really clear things up. Lifestyle things that we always talk about: castor oil packs, Epsom salt baths, rebounding, sauna, coffee enemas, dry brushing. Now, heat can also play a role depending on the person, so you want to be a little bit mindful of that. But sometimes just doing drainage pathway support work can go a long way. Toxin overload issues can also play a big role in this. Mold most commonly, but also heavy metals and environmental toxins can also play a really big role in histamine-related issues. Mast cell issues are another really, really big one, especially because when mast cells are chronically dysregulated, they produce histamine. Mast cell issues, I'm also going to throw POTS, SIRS in here too, because they are all commonly associated with histamine issues. Those are all symptoms, not root causes. Yes, for many of these, we need to support from a symptom perspective. For example, with POTS, we want to really take a big look at water intake and electrolyte intake. That plays a really, really big role. Mold also plays a really big role in a lot of people. Parasite overgrowth play a really big role in a lot of people. SIRS is just, it's a chronic inflammatory issue. It's that is all it is. It's your body. It's once again, it's one of these blanket kind of statements: fibromyalgia, IBS, IBD. It's Western medicine's way of saying, hey, you have a chronic issue that you fit all of these symptoms, and we've ruled out anything else major. So this is what you have. For SIRS, there is some specific testing that we can do. For POTS, there is a test, a tilt table test that we can do. For MCAS, a little bit more challenging to specifically test for. But these are still symptoms. So if you have mast cell issues, if you have SIRS, if you have POTS, zoom out, bigger picture. What is impacting these things? What triggered these things? What other kinds of stressors are going on in the body that activated, that triggered, that started these chronic issues and have kept them going? We need to look at all of these things. And all of these factors will determine, okay, what is the best way to actually start in supporting, whether that's medications, supplements, lifestyle things, nutrition, all of that. So first and foremost, for us at least, we zoom out and we figure out the root causes. Then we come up with a plan that is going to help support and address those bigger root causes without being crazy aggressive and you having to change your whole life just to get better. We meet you where you are and come up with a game plan and different tools to help and support the body as we go through the healing process. That is the route that we take. So I want to wrap up with just a handful of supplements that can be supportive if you are looking to symptom manage and or you need to buy yourself some time and or just some relief as you go here. So DAO is a big thing that a lot of people will use to help break down histamine, especially in relation to food-related histamine reactions. Beef kidney is a really common one that is used. Kidney is very naturally high in DAO. A lot of people will take kidney just by itself, whether they eat it or they take it in capsules. And there's a lot of companies that have some really good kidney options here. Another one that is specifically DAO focused is Histigest from Designs for Health. That's something you take like shortly before you eat, helps to break it down. DAO enzyme from Seeking Health, another one. So just a couple different options here from DAO type supplements. There's also something from Seeking Health called histamine nutrients. That can be food or non-food related for reference. That can be taken in between meals to help with just generalized histamine issues. I'll also tell you just blanket statement when it comes to histamine related issues specifically, I'll say like allergy kind of issues, I do also love homeopathics. I have personally found homeopathics to be very supportive during acute allergy kind of related issues. I know I've used some in our travels in different areas where I feel like I'm reacting to some, just my body's not used to certain allergens in the area that I've taken, short term, some different homeopathics that can be really valuable. Desbio is one of our favorites when it comes to homeopathic kind of remedies. So I'll put a link to our Desbio store if you want to look at that. And you can get, they have some really, really good ones, a variety of ones in it. It really depends on what the person is dealing with, which one we may recommend. So I'm not going to give you a specific, just do this one because it really varies. If you are on a probiotic, that can also be a trigger for histamine issues, especially if you have gut overgrowth on top of that. There is a low histamine probiotic that we will often recommend when we're doing gut rebuilding for people with a history of histamine-related issues. That's also from Seeking Health. It's called Probiota Histamine X. That's a really good one. Big fan of that one. I already mentioned Chastity Vitex if it's more of a estrogen to progesterone kind of ratio issue. When it comes to looking at kind of estrogen metabolism, drainage pathways, there is another product that we will often use that can be very effective called TEDCA. There are a few companies that do it. Body Bio is my second favorite and most available. The one from Cellcore Advanced TEDCA is the best one. We have compared it with 3 other brands, and the one from Cellcore blew it out of the park every single time. So it just works a little bit differently, works with the body, helps with brain drainage, especially too, which can be very supportive. So that is another option. And then mast cell stabilizers. I would recommend listening to one of our other mast cell specific episodes and or check out that mold, mast cell, and histamines masterclass we're going to put in the show notes here because there's a lot, like 16 up to like 24 different ones. We primarily work with a handful of ones. It is a little bit case by case basis. I'll tell you, the real basics ones, quercetin and vitamin C are most often used. If you are dealing with a lot of mast cell issues, you can react to those though. Fisetin can be a good one. Luteolin can be a good one. Perilla extract can be a good one. There's a evening primrose oil for certain cases can be a good one. So there's a lot of different factors that go into the mast cell stabilizer piece, but some people do better on mast cell stabilizers versus more of the breaking down histamine piece because it's more of a mast cell issue than a directly related histamine issue. So as you can see, these things are very complex. There is no one answer. There is no one size fits all. And I think these people who are promoting, just take Zyrtec, Allegra, Claritin, which are, certain types of histamine blockers. We add in, a Pepsid, like Pepsid, like Pepsid AC, which is a different type of histamine blocker. We have TH1 and TH2 blockers. That's why those are often recommended together. And they can cause issues long term. Taking something that's going to lower your stomach acid long term get into some really dangerous territory with your gut, and that can exacerbate things for sure. If you are taking allergy pills, any one of those three that I mentioned, be sure to look at the bottle. Most of the generic versions will contain high levels of aluminum, which can impact your drainage pathways and also create toxin overload issues, which can then exacerbate all of these histamine issues. So just do your research. There is no right way to look at this. As always, like, we offer free consultations. If you want a little bit more specific, deeper dive insight into your specific case, individual issue, that is also a starting point. If you are looking to work with us, we prefer to do those one-on-one consultations first, so we can make sure, like, do we need more testing? Do we, can we decide, like, do we actually know what's going on first and foremost? Do we need other testing? Do we need to look at some things first, or what does that game plan kind of look like? So we always have that in our show notes, so you can always book that too. Thank you for listening. As always, please like, subscribe, follow if it resonates. 5-star reviews really, really, really mean the world to us. Thank you for listening, and we'll see you next week.